A baby girl of just 25 days got COVID, possibly from her parents. She was at the hospital in Bhubaneswar. You see those pictures on your screen right now. It got at one point quite complicated and she developed multiple seizures, had to be then put on the ventilator as well. But remember, I told you that this is a story of hope? Well, she now has fully recovered and in the comfort of her home and family. This was obviously possible due to a fantastic team of doctors around her, and they join us now in this conversation. We have with us Dr. Arjit Mohapatra and Dr. Bibhudatta Mishra as well. We'll be joined by her shortly. Dr. Mohapatra, firstly, thank you for what you continue to do, not just for this baby girl, but every day now for over a year now. And I'm sure this is the kind of story, I think, which gives us hope. I'm sure it's spreading smiles even inside your ICU. If you could unmute yourself, sir, please.
Yeah. So this baby girl was definitely special to us. We got this baby when she was 25 days old. And when she came to us, she was really in a bad shape in terms of she was hardly able to breathe and having high-grade fever and also multiple episodes of seizure. And so then we had to take care of the baby in terms of putting her on ventilator, then giving her other types of additional and supportive treatment in terms of remdesivir, then IV fluids, steroids and other associated things. So finally the baby responded after 9 days of struggle on the ventilator. Then we could take out the baby off the ventilator after 10 days. Then the baby was started on feeding. Then baby took to mother's feeding as well. And finally got discharged after 20 days of hospitalization.
Right, the minute you say discharge, the minute you say the baby is back with the mother, there's a wide smile on everybody's face really. And again, thanks to you guys that it's been possible. I also have with us Dr. Mishra now. Dr. Mishra, what was your experience? I'm sure this girl was special. Every story of hope is special. We all need it so badly right now. But it is complicated to deal with such newborns or babies in general dealing with COVID. How did you make that possible?
As we all know, this COVID second wave is affecting children, and we faced such cases. Last two cases, they presented really sick, and with God's grace, this child got cured, and he required very high ventilator setting and other things, lots of supportive care. But luckily, we could save the child.
Right. You say luckily. I'm sure there's more than luck that just went into this one. Could you share with us your experience of the past 1 year? How has it been? I know a lot of anxious parents, a lot of young lives have also been lost, especially in the past 1 month or so, where we've seen the peak of the second wave really take place in the northern part of the country. At least we're seeing that go to the southern part now. But in your experience, what are the major learnings at this point that you can perhaps share with our viewers?
Yes, this time COVID in children, they're presenting with like minor flu-like symptoms to gastrointestinal symptoms. Some of them they are presenting with very difficult, like breathing difficulties, seizures. They are also presenting with desaturation. The most important part is to take care of them when in need. That means very early intervention is much needed, and definitely a lot of supportive care is much needed. At the same time, we should counsel the parents and give some positive hopes.
Yeah, if I could go back to Dr. Mohapatra now. Dr. Mohapatra, is the baby absolutely good now? We understand that steroids, medication, being on ventilator at such a young age, there is obviously going to be precautions that she needs to take even when back home now.
Yeah, baby is absolutely fine now in terms of feeding and other parameters. But as you spelled out, all these things, remdesivir, steroids and all that. So we have to be on high alert to follow up this baby to find out if anything in terms of growth, development or any physiological things that may falter out of the normal trajectory when the baby grows. So we have to have a very close watch on this baby during especially the first year and subsequently till at least about 5 years. This baby needs strong
Right.
and close follow-up.
Right. And my last question really, how are the parents also doing? I understand it's a very anxious time for them. And thank you all again and your team of nurses. I was trying to ask you in the beginning also the same thing. This is stories, every life saved right now is a story of hope. And I'm sure it's spreading some smiles even inside your ICU, even inside your hospital.
Yeah, definitely. It's a story of hope. It's a story of fight back from the little girl. And in this difficult time when the pandemic is raising havoc around the world, so this is a very hopeful and very bright side of the things which is happening. And really, we all are happy as a team. We have worked so hard round the clock for 20 days. All our staff, support staff, nursing staff, doctors, they're all are happy. And so far as the parents are concerned, the parents are absolutely now fine. The father was admitted to the ICU. He has been discharged and he is fine. The mother was mildly symptomatic, so she was not admitted to the hospital. But unfortunately, the child lost the grandfather who could not be saved.
Okay. All right. At this point, just want to end by saying thank you to both of you again. Keep doing the good work. I'm sure a lot of wishes and duas are coming your way. Thank you, not just for this baby girl, for so many lives I'm sure that you're saving on a daily basis. Thanks for joining us on NDTV.
Thank you.